Unfortunately, in Australia, particularly in regional and rural areas, finding access to a midwife is really hard.
In a health system in crisis, who is looking out for those often left behind? Here in regional Australia, one midwife is standing between hundreds of vulnerable women and the collapse of their care. Vanessa Page's Endorsed Midwife Care program has guided more than 260 at-risk mothers through pregnancy, from Indigenous women to refugees and those facing financial hardship.
With social disadvantage comes clinical risk. So these women inevitably are going to be complex and have a higher risk pregnancy.
Vanessa provided specialised support to 260 marginalised women through their pregnancy. But the program now faces closure unless Gateway Health can secure the $120,000 in funding.
It's really devastating. It's been one of the hardest decisions I've had to make in my career, just particularly knowing the impact not only on Vanessa but also on the women that come through our program and the families that we've been able to support.
I just think about other women as well and how much they're going to struggle without the service in place.
To be honest, if there's not a service available that caters for their complexity and their social circumstances, then I believe a lot of women will end up having ad hoc pregnancy care, which will ultimately result in adverse outcomes.
Despite being recognised as 2025 Australian Midwife of the Year, without that financial lifeline, Vanessa's program will be cancelled, and she unfortunately has already started this process.
I've had the high of winning Australian Midwife of the Year, and now I'm riding a low whereby a program that I've set up from scratch and I'm absolutely passionate about may be ending.
I'm gutted, and young mums as well, young first-time mums with nowhere else to go. Having someone to talk to, someone to listen to, it's just so important. And I think about those women and it makes me sad that they'll have nowhere to go and no one to talk to.